Has your child been to countless doctor appointments, had multiple rounds of blood work, maybe even had an MRI or other expensive tests, yet you still don't have the real answers about what's causing their chronic health struggle? You've been told that everything looks normal on their labs, but your child is still dealing with these challenges: sleep issues, digestive problems, behavioral issues, or even developmental delays. Meanwhile, your pediatrician keeps saying they'll grow out of it, don't worry about it, or even if they offer another medication to manage another symptom. What if I told you, though, that there's a crucial exam that reveals the real root cause of why your child is having a health condition, one that most doctors never perform? An analysis that is so advanced that it can detect hidden dysfunction that traditional medicine completely misses, yet it's completely safe and non-invasive for children as young as 1 day old. Here's a staggering reality that should really concern every parent. Traditional medicine relies primarily on the science and looks for obvious pathology on standard exams, whether it's blood work, MRIs, or EEGs. Yet these tests often come back normal even when a child is clearly struggling with a significant health challenge. What's missing from this approach is an assessment of the most crucial system that determines whether your child is healthy or not, which is the central nervous system. Dr. Bruce Lipton, a renowned cell biologist, puts it perfectly. The function of the nervous system is to perceive the environment and coordinate the function of all other cells. This means that while you've probably invested considerable time, energy, and resources trying to improve your child's gut health, immune system, and even their motor development through various therapies, most healthcare providers have completely overlooked the most common thread that ties them all together, which is the nervous system itself. So we first have to understand what this nervous system analysis is and how crucial it is. Because the central nervous system is the air traffic control for your child's entire body. It coordinates every internal function, every movement, every thought, every emotional behavior, cognitive process. It makes it the most important system to assess. Traditional medicine chases these symptoms, and they move through these movement-based therapies to assess muscle tone, whereas pediatric chiropractic is the only healthcare delivery system that actually evaluates the nervous system function through advanced technology. Your child's brain doubles in size during the first year of life, and it continues to rapidly develop, making the nervous system assessment during this crucial period far more important than knowing where they sit on their height or weight chart. It's a different form of an analysis that we're using for non-diagnostic impressions, just looking at why your child's body is struggling. These INSiGHT neurological scans are different than any other evaluation. There is first a neurothermal scan, which identifies regions that are affected by subluxation and dysautonomia that will affect your child's digestive system, their immune function, their hormones, or even things like sleep regulation. This neurothermal scan uses a temperature analysis to understand where stress patterns resonate within the surface of the spine. The purpose of those bones that create your child's spine is to protect that spinal cord, to house those individual nerves, which make up that autonomic nervous system. Now, this dysregulation within the spine that we can see from the neurothermal scan helps to explain conditions like colic or reflux, constipation, chronically affecting ear infections, allergies, and these are things that traditional medicine really focuses as unrelated issues. They don't focus on these areas as the root cause. The second scan is a neurospinal EMG scan, which measures neuromotor system function, which is vital for investigating conditions like autism, sensory processing disorders, ADHD, and anxiety. It detects 3 key patterns we call the raging bull, which is hyperactive and anxious children, the drunken bull, which is a coordination and focus issue, and then the raging drunken bull, which is a combination of both of the ones that we discussed above. Now, the third scan is a heart rate variability, and it assesses your child's adaptability and resilience. It reveals whether their nervous system is healthy and balanced or stuck in a chronic stressed out mode. These key markers help to determine how well the body can adapt to physical, chemical, or environmental challenges within their environment. Now, these scans explain what traditional medicine cannot. The INSiGHT scans detect subluxation and dysautonomia, which is the real root cause which creates three major problems within your child's nervous system: stuck stress and tension, lack of balance and coordination, and overall disorganization and dysfunction. These scans reveal why your child isn't actually growing out of these early challenges, whether it's colic or tantrums, but instead how they grow into more serious conditions like ADHD, anxiety, sensory processing challenges, and chronic illnesses as they progressively age. The technology provides precise measurements and tracking of this neurological and nervous system dysfunction. It allows us to personalize a care plan that addresses the root cause rather than just masking or managing symptoms with traditional medications or endless therapies. The INSiGHT scans are so powerful that they aim to look deeper at the real root cause of why the body is doing what it's doing and why your child is not progressing through the traditional avenues that you've taken them through, which is medications and traditional therapies. If you're interested in learning more, click on the link below. Learn more about the INSiGHT scans and how this technology can help to identify other causative factors that are causing your child's health to struggle. We look forward to helping you.